One night in early January this year, a BBC News journalist filed a report on a new and apparently fatal virus which appeared to originate in a food market in the Chinese city of Wuhan. It had previously been reported as a pneumonia outbreak, but this first death proved to be something rather different. As news of this novel virus started filtering out of China, false narratives and rumours were already gaining pace around East Asia. As it spread into the Asia-Pacific area and then on to Europe and the rest of the world, the information followed and grew. As the World Health Organization noted, disinformation about the virus was spreading globally as fast as the virus itself. It was clear that the BBC would not only need to explain the emergency, but also separate fact from fiction. Now, fortunately, our disinformation team, set up in 2018 to counter the rising tide of so-called fake news, was already looking into issues surrounding vaccines and false health claims. With BBC Monitoring's unique blend of global and local experience, we were able to show how the virus was reported and misreported around the world, but we could not do it alone. So BBC Monitoring's disinformation team joined forces with the fact-checkers from Trending and Reality Check to present a united front against COVID disinformation across BBC News. Our coverage has evolved from the confused early days of fake cures and misleading advice towards more nuanced coverage as the pandemic merged with a cult-like QAnon conspiracy and US election campaign. Here's Olga Robinson.
This unique situation also created a number of challenges for us, both editorial and technical. First of all, the sheer volume and amount of coronavirus misinformation across multiple platforms and languages. To tackle this, we used a variety of news gathering and social media analysis tools like Spreadfast and, crucially, CrowdTangle, which allowed us to sift through thousands of posts, identify viral misinformation in a short period of time, and also nail down exactly how claims spread on platforms like Facebook, Instagram, and Reddit. And we also had the extraordinary resource of our monitoring colleagues who were able to point us to trends appearing in a variety of territories across the globe. With everyone working remotely and a new team to pull together, we also had to make drastic changes to the way we communicate between this new group and with the wider BBC. A rotating daily disinformation duty editor was appointed to steer the agenda and communicate with the main news outlets. The usual morning news meetings became virtual stand-ups, and a daily email was sent to commissioning editors with our prospects. A WhatsApp group was also created, allowing a recreation of the chat you get in newsrooms. Have you seen this? What do you think about that story? And it actually did improve our reaction time to new developments. It was overwhelming though at first, but it did allow us to work more efficiently, avoid duplication, and work much more collaboratively. The other big challenge that we faced during the pandemic was potential amplification of misinformation. When do you decide to cover a misleading claim and bring it to the attention of audiences across the globe? The key test for us was impact. How likely was that this piece of misinformation would affect people? Had it crossed into multiple languages? Has it been shared by thousands of people? Is it so dangerous that even if smaller numbers of people saw it, it could affect health or their well-being or even society in general?
All of those questions, coupled with the fact that many of the misleading claims we monitored contained harmful medical advice or false narratives about local and national guidelines, meant we had to be even more cautious than usual about the claims we chose to investigate. We therefore decided to use a variety of social media analytics and metrics to roughly measure the reach of a misleading claim and focus on those that, in our view, had reached at least tens of thousands of people. One manifestation of this is the global rise of the QAnon conspiracy theory. Its followers believe President Donald Trump is secretly fighting a global cabal of Satan-worshipping pedophiles and rely on messages from a mysterious figure known as Q, who claims to be part of the investigation and posts cryptic messages about it on an anonymous online board. QAnon was already a well-known conspiracy, but before this year, its claims and narratives were mostly relevant to a specific group of people in the US. But the pandemic gave the conspiracy an opportunity to reach a global audience. Their misleading claims about COVID-19 being a bioweapon, masks, vaccines, and elite child abuse suddenly reached other conspiracy communities, and also thousands of ordinary people in lockdown around the world that otherwise would not have necessarily been too enthusiastic about US politics and culture. For instance, when the first human trial of a COVID vaccine began in Oxford in April, a completely false claim about the first volunteer dying went viral. Although the claim was first published by an obscure fake news website with very limited reach, QAnon Facebook groups with hundreds of thousands of members began sharing it, and from there it reached global anti-vaccination and conspiracy communities, reaching millions of online users in multiple languages.
The endpoint of our investigations are published across as much of the BBC's media space as we can manage, online, radio and television, and we enthusiastically share our work on social media. It's true that sometimes we run into dead ends where it's not possible to conclusively separate fact from fiction. We have to report that because sometimes the truth is uncomfortable or confusing. There are also occasions where our findings go against received wisdom, and there are also times when a situation changes, and then so must our reporting. We're only human, and we occasionally make mistakes. So we have to admit when we are wrong, otherwise we lose the trust of our audience. And there are also times that whatever we say, somebody will disagree, usually very loudly. That means there's a personal price to pay. Several members of our team have faced abuse and threats from online trolls who are convinced that the anti-disinformation team is, in fact, in the pay of a huge global plot to hide the truth. We have to agree, then, that some people will not be convinced whatever we say. Our task remains to use the technology and skills at our disposal to inform and explain.